So today I'm going to show you sciatica exercises using a chair. So most of you are either sitting at home, sitting at work, sitting while driving your car, sitting while traveling in the bus to go to work or any other place. All this sitting causes compression of your spine at your waist. That gives rise to sciatic nerve being pinched at the buttocks. I myself had it. It's not good, unpleasant. You can't sit comfortably, you fidget around, and you want to get rid of the pain. What to do? Since there is no running away from this, you adapt and you improvise. Use the same chair and use simple stretching exercises to do at work or at home. First, have a seat all the way in the back. Make sure your weight is equally distributed. Okay, most of us have a habit of sitting like this or like this or like this, whatever. What it does is uneven weight bearing on the buttocks. It causes one side is compressed more than the other. Simple remedy: try to keep a straight posture while sitting. In sitting, you can raise your leg this way. Make sure to keep your toes pointing towards you. You will feel the stretch in the back of the leg, all the way from your waist till the tip of your toes. That's the length of the sciatic nerve. Starts from here, goes all the way till the toes from the back of your leg. So simple exercise: 1, 2, 3, 4, 5. Second variation: keep this position and maintain the stretch. Toes towards you. 1, 2, 3, 4, 5. Second, figure of 4. If my right side is affected, I will bend my right leg. Only do it as much as you can tolerate it. No need to bring it all the way here. No. Just do it as much as you can tolerate it. And suppose right leg is affected, right knee try to bring towards left shoulder. Rocking movement. Okay? You can do this while lying down on the bed as well, while sitting as well. If this is difficult, try and bring your left shoulder to your right knee. You will feel exactly at the source of your sciatic pain a stretch. That is where your nerve is compressed. Okay? Second, knees in and out, in and out, in and out, in and out. Third, calf raises. Okay, these are the exercises you can do in sitting. If you want to do more, you can increase, add additional weight of your unaffected leg and then do the raises. It's like working out using a dumbbell, but your own body weight. You can do these exercises as well. Continuing further, using a chair as your base, more exercises for sciatica in standing, using a chair. I'm going to show you sideways. Ideally, the chair should be fixed to a stationary position like a wall so that it doesn't move. This is just for representational purposes. Grab the chair with both hands. Start bending the knee in the back. Keep the spine straight. Keep this straight. Keep this straight. Don't bend. Just bend backwards from your knee. You will feel the stretch in the front of your knee. This is technically not sciatica, but the muscles around that nerve that need to be stretched. Specifically these hip flexors, knee flexors. They need to be stretched. Knee extensors. They need to be stretched. My bad. bend it backwards. Second variation, kickbacks. Okay, make sure that you are holding and you are not leaning into it. This needs to be straight. Stretch backwards. You will feel the stretch in your glutes, that's your buttock region. That is where the nerve is compressed the most. Third variation. Same as front and back, do it sideways. Okay. Do this only as much as possible. No need to bring it all the way up, but make sure the rest of the body is straight. 1, 2, 3, 4, 5. Repeat for this side as well. 1, 2, 3, 4, 5. If possible, lean against the wall and try and do semi-squat. Just hold this position. It's as if you're sitting on the chair, but not ideally. You're not completely letting go of your body weight by sitting on the chair. Just imagine you are sitting on a chair. This will work your thighs, back of the thighs, core muscles. Okay? Try and hold this position 30 seconds. Slide back up. Always use the support of the wall. Don't do this without any support. Now I'll be showing you stretching using a chair propped up against a wall. If possible, try to put one leg on the chair. It should be positioned so that it doesn't move against a wall. And try to go up on the other leg. 1, 2, 3, 4, 5. Alternatively. This leg, if you want to stretch, use the other hand to try and touch your toes. You will feel a stretch in the back. Switch. 1, 2, 3, 4, 5. After this, switch and turn. This shoulder, this knee. Switch and stretch. Switch and stretch. Do only as much as possible. If you are not able to do 5 counts, 7 counts, 10 counts, start with 3. Breathe in between the counts. Take your time. Both the legs together. Hold this. 1, 2, 3, 4, 5. You will notice that I am bending a little bit. If you don't want to do that, turn this around. Hold this straight. Go back a little bit. Now you do the stretch. The more angle you give to your ankle and back of the leg, the more you will feel the stretch. If you don't have a chair, you have a wall. Push-ups position, stretch as much as possible. 1, 2, 3, 4, 5. If this is difficult, just maintain this stretch. 1, 2, 3, 4, 5. Now I am going to show you sciatic stretches when you are sitting. If this position is difficult for you, do not try this at home. Only do this if you are comfortable, and only do this as long as you can tolerate it. So, the figure of 4, ideally this way, and then you try and bring this knee to the opposite shoulder. Cheat sheet. If you can't bring the knee to the shoulder, bring the shoulder to the knee. Okay, do this. You will feel a stretch here. Crisscross, other side. Knee to opposite shoulder. Use both hands. Cup the knee like this and stretch. You will feel a stretch here, right where you are putting the weight when sitting. This is for your sciatic nerve. If you can't do this, bring this shoulder here. Okay, simple. Second, butterfly pose. Opens up the hip. Try to join these, bring it as close as possible. Try this rocking movement to bring it closer, and this. Ideally this should touch the floor. So even for me, my hamstrings are tight. I am also trying to get them to stretch. This is what will help you. Butterfly pose. Okay? Don't push your body. Just follow as much as its pain allows you to. Okay? It is very important to start slowly and progress gradually. So 2 variations. You can do this to a count of 10, or you can try and hold this for a count of 10. These are the 2 variations. Next, straighten one leg, rest this, straighten one leg, try to push it down. You see this gap should go down. This static quads helps to strengthen the muscles around the knee. 1, 2, 3, 4, 5. Second variation, push and hold. 1, 2, 3, 4, 5. Once you are done with that, try and mobilize each and every joint of the leg. Isolate the joint, try moving it. Up, down, right, left, clockwise, anti-clockwise. Up, down, right, left, clockwise, anti-clockwise. Why I am specifying this? When you stand up and you walk, you need all your joints, 3 of them, ankle, knee and hip, to be flexible. Okay? If at any point the flexibility is not there, you will feel the pain when you are walking or when you are shifting your weight. So ankle is done, now knee. Only 2 things, just straighten it and bend it. Only as much as tolerated. That's it. For the hip, try sitting this way, try sitting this way. If possible, try sitting this way. This is called W sitting. What we are trying to do is increase the hip range of motion. Ideally, it should be able to go both ways. Okay? Go slowly. One last exercise for lower limb mobility. Take any vertical surface. If you are lying down flat, and try to keep your legs straight as possible. This will help take off the weight from the hips, from the knees, from the ankle, because you are in anti-gravity position. Now, stretch your affected leg, stretch your normal leg. You will feel the stretch from the back of your hip, the tip of your toes, along the back of your leg. Even in this, you can try the figure of 4. Try to bring the knee close to your body. This is a good exercise for lower abs and core strengthening as well. So notice here I am using my normal leg to bounce off the wall and try to bring this hip. Any activity you do on your own is counted as exercise in my books. You don't have to have a 6-pack or 8-pack to do it. As long as you do the movement yourself, it counts as exercise. So give yourself a pat on the back. Well done. So now I'm going to show you some sciatic stretches while you are lying in bed. So first and foremost, this will be my normal side. This will be the side where I am having sciatica. So ideally you should try and do these stretches on your own. If not possible, use any helpful equipment. For representation, I'm going to use this towel. To start with, you start with ankle mobility, up, down. Do a count of 5 to 10. Then static quads, push the knee down, 5 to 10. Heel slides, 5 to 10. leg raises 5 to 10. If this is not possible, use a towel, use both hands, roll the towel up, flex it around the ankle like this, stretch it. You see this normal foot and see this foot. I'm stretching the ankle. You feel this stretch, use your hands to pull it up. See this is what should be pulled. Okay. Since my hamstring is tight, I'm not able to do this completely. Ideally, those toes should point towards me and they should be straight. If not possible, use this and get the same result. The whole sciatic nerve will be stretched. This is one position. Further, if you want to improve your sciatica, hold this, bring it to the opposite side and stretch. See this tendon? See, because my hamstrings are tight, it is bending. I need to keep it straight. Do this on empty stomach. Start with 3 counts, progress to 5, 7, 10. Same exercise sideways. If I'm used to sleeping this way, if this is my affected side, always keep the painful side up. Okay. Use extra pillows between the knees to prevent the weight of this falling on the other knee. This needs to be relaxed. In this position, up and down, front and back, both the movements, reverse and knee bending. This will help free up your sciatic nerve. Second, this pillow you can squeeze. This will help strengthen the glute muscles. Squeeze. You can do this straight, you can do this sideways as well. Last, when you try to come on your back in the bed, this is affected, this is normal. One, 2, 3, 4, 5. So I'm not bending the knee, just lifting from the waist. Second, bend from the knee and lift from the waist. Bend at the knee and lift from the waist. Third, try lifting both the legs at the same time. Don't do this if you are not confident or you feel it is too painful. Two variations, up, down, up, down, up, down, or up and hold. 1, 2, 3, 4, 5. Next, push-ups. Always use soft surface. Use your upper limbs. Try and come up as much as possible. Try to hold this, and if you can tolerate it, do this. Next, in this cat and camel stretch, this will increase your hip mobility. In this position, try to go in alternate hand and alternate leg. Okay? It has multi-purpose benefits: core strengthening, balance, and hand and leg coordination. Okay, if you want to improve your core stability, try to go back on your hands. Try to come on your knees. In this position, only if it is possible, try to hold your ankles. This will stretch your hips and your knees.